Hello. Hi, Dr. Saad. Hello, Dark Knight. Good evening, everybody. Good evening and welcome. So, before we actually get into the session, can I get the quick confirmation that audio visual is good to go? Good evening, Kelly. Is the audio visual good to go? So, you can hear me and you can see the PPT as well. Very good. Thank you, Dark Knight. Thank you. Good evening. Thank you, Dr. Saad. Thank you, Kelly. All right. So this is in continuation with the yesterday's session. So all of you, those who had attended, we had discussed some of the previously year PFC questions with some discussions. And again, today I'm going to take some more, thank you, Sahana, some more questions, and we're going to discuss again around those questions. So as it was yesterday, the room was buzzing. Good evening, Mayur, with a lot of participation. So do that similarly today also. Participate as much as you can, and because you know this is the time where you can afford to make mistake in the room and we can correct. Okay, so this is the time. So go all out and let's start the session with the first question. So are you ready? Let's start. Good evening, Campylobacter. Good evening. All right. So the first question of the evening. A hypertensive patient has renal failure with GFR of less than 30 ml per minute. So which thiazide diuretic will be the best for this patient? Very good, very good. We are getting the answers already. Metolazone. Excellent, excellent. Yes, that is the correct option. Yes, very good. All of you are bang on, correct. Metolazone. And now let's discuss briefly about the various important points about the diuretics. Okay, so this is a picture of the nephron and the various parts of nephron. So first and foremost important is the site of action of these diuretics. Have been asked before, you know, in the last FMG exam, this was a picture given and the cross I've marked here was the site which was asked which of the diuretics act at this particular site. So can you tell me, let's start from the site number 1. This is the site number 1. Which diuretic will act on this particular site? Which diuretic acts on this site number 1? Site number 1, yes, CA, very good. Carbonic anhydrase inhibitors act on site number 1. Now, which diuretic acts on this site 2 as well as here? The second. Which of the diuretics act here? Yes, Aftab, Vaseem, Campylobacter, all of you are correct. No, loop diuretic is not here. Loop diuretic is not here. No, loop is not here. Yes, very good. Very good, Vaseem. Mannitol. This is a site for osmotic diuretics. Okay, so don't get confused here. This is the site for osmotic diuretics. ये जो third site है यहाँ पे, this is the site for loop diuretics. Okay, this is the site for loop. The thick ascending loop, that is the site. Every site, but mostly it is the PCT and the loop which is most common. Okay, it can act here, but ये most common है. अगर पूछा जाएगा, so you have to mark here the osmotic diuretics, most common site, most important. So loop is going to be here. Okay, so loop is going to be here. Now what about the site number 4? Site number 4. This was asked in the exam, so let me ask you. Site number 4, the distal convoluted tubule. Very good. Thiazides. Excellent, Sam. Excellent, Aftab. And excellent, Campylobacter. So thiazides act here. And this is the site number 5 here. Site number 5. Very good, Dr. Ravi. Very good, Vaseem. Yes, Sairam. Good mnemonic to remember. Yes, aldosterone or the aldosterone antagonist, that is there. Aldosterone antagonist. Right? Aldosterone antagonists. So these are the various sites which are important, right? So एक तरीका to remember, you can remember COLTS, COLTS का एक mnemonic, just remember COLTS. ठीक है? NEET PG this year, yeah. Mannitol was also asked. So mannitol was asked in another fashion. It's in the NEET PG. So that was asked, and I will discuss in the what fashion it was asked. So calls you can remember, okay? So that you can see. Now, what are the important points now? Let's do about the thyroid. So the site, please remember, sites are very important for these. And let me ask you another thing here, before I go to the other part. So which of the diuretics here acts, which of the diuretic acts from the basolateral side? Which of the diuretics out of these acts from the basolateral side? Yes, it was asked, dialysis disequilibrium syndrome. Which of the diuretic acts from the basolateral side? Mostly all of them act in the luminal side. Which of this? Yes, aldosterone antagonist. Excellent. So they will act from the basolateral side here. Yes, potassium sparing, aldosterone antagonist. Excellent. Now let's quickly go and fire these shots. Okay, quick shots karte hain about these diuretics. So are we ready? Most potent loop diuretic. Most potent loop diuretic. Most potent loop diuretic. Very good. Bumetanide. Bumetanide. NID. Yes. Excellent. No, it's bumetanide is the most potent loop diuretic, right? Yes. Maximum hypokalemia is caused by which diuretic? Maximum hypokalemia. No, maximum hypokalemia is caused by which? Yes, it is the carbonic anhydrase inhibitors because just sodium ka absorption that's maximum at the PCT. So whichever diuretic deals with that is going to have the maximum hypokalemia later on. Okay? Maximum is with carbonic anhydrase inhibitors. They do cause hypokalemia, but maximum agar option it is carbonic anhydrase inhibitors. All right. We have discussed this diuretics which work from the basolateral part of nephron. You've already told me the answer, which is your aldosterone antagonist. That you have already told me. Excellent. Now, highly ototoxic diuretic. Highly ototoxic diuretic. Ethacrinic acid. Excellent Campylobacter. It is ethacrinic acid. Very good. Highly ototoxic is ethacrinic acid. Yes, Saidam. Alright. Diuretics we just did in this MCQ, which can be used in the renal failure insufficiency when the GFR is less than 40. Yes. Yes, Sairam. GFR is less than 40. The best choice we have is loop diuretics. But the only thiazide which can act here, which we did in this MCQ, is your metolazone. So remember these two. Loop diuretics are the best, but the only thiazide which can be given is metolazone. Right. Now diuretics which can be used in the calcium stones. That means if there is stones in the urinary calcium stones. ठीक है, कौन से use कर सकते हैं? Thiazide, very good. These are your thiazides. These are your thiazides. Excellent. Which can be used are your thiazides. ठीक है? So, why? Because thiazides, what do they cause? What is the effect of thiazides on calcium? What is the effect of thiazide on calcium? What is the effect of thiazide on calcium? Okay, they increase, yeah, they retain, yes, they retain, yeah. So they will cause hypercalcemia in the body. Okay? And this is the difference between the thiazides and the loop diuretics. Yes, loop loses calcium. Okay? So they will lose calcium And this is the major difference between thiazides and the, yes, they major difference between thiazides and the loop diuretics. Otherwise, जो loop diuretics के अगर हम side effects और the act याद करें, so they will cause increase in the glue. ठीक है, glue sticky होता है, increase in the glue, hyperglycemia, hyperlipidemia and hyperuricemia. Same is with thiazides, hyperglycemia, hyperlipidemia, hyperuricemia. और जो ions की बात करें for the loop I am talking, hypokalemia, hypocalcemia and hypomagnesemia. So this you don't have to remember the differences. You can remember the same for loop as well as thiazides. The only difference is the calcium. Only difference is the calcium. Yes. Only calcium में आपको बस याद रखना है, सुना. The rest they remain the same. Right? Okay now. Let's go on to the next one. Some more points about this. Diuretics, which is useful in nephrogenic diabetes insipidus. EDTQ, I don't understand. Calcium चाहिए ना बेटा, we need calcium. ठीक है, so we need calcium in osteoporosis, so it retains calcium. Diuretics used in nephrogenic diabetes insipidus. Calcium does not accumulate in the kidney. Yeah, because in case there is a calcium stone, then we don't want the thiazides. We want the thiazides because they will not allow the stones to form, because they won't allow the calcium to accumulate in the lumen, the kidneys, in the urine. Okay? But if there is a problem, hypercalcemia or in malignancy, then we have to give loop diuretics because we have to eliminate calcium from the body. That's the major difference between two. Yes, coming back to this, nephrogenic diabetes insipidus. Yes, very good. It is thiazides. Thiazides. So what about अगर neurogenic होता centrally, central वाला neurogenic diabetes insipidus, then what do we use? In neurogenic, which is the drug in neurogenic? Yes, Dr. Shubham, you're right. I think you have written neurogenic, you wanted to write, but you wrote yeah, desmopressin. Excellent. Drug of choice in cirrhotic edema. Drug of choice in cirrhotic edema. Cirrhotic edema. Very good. Aldosterone antagonists like spironolactone, because these patients have a lot of increased aldosterone levels. Drug of choice in pulmonary edema. Pulmonary edema. Potassium sparing, right. Why? Okay, another point अगर मैं पूछूं, spironolactone का major side effect. What is the major side effect with spironolactone? Yes, इसका answer is right. Furosemide. You're all right. Furosemide. What about spironolactone? Major side effect with spironolactone? Gynecomastia. Excellent. That's why we prefer eplerenone, which doesn't cause this. Major is gynecomastia. Hyperkalemia तो करना ही है, ठीक है? All right. Drug of choice in cerebral edema. Cerebral edema. Yes. Cerebral edema. Mannitol. Excellent. Mannitol. Drug of choice in lithium-induced diabetes insipidus. Lithium-induced diabetes insipidus. Very good, Dr. Shubham. Amiloride. Amiloride. Diuretic which is contraindicated in cardiac failures, pulmonary edema. Very good response. Yes. Diuretic which is contraindicated in cerebral hemorrhage or pulmonary edema. Yes, Dark Knight. It is mannitol. And the question was asked was, which diuretic is used in dialysis disequilibrium syndrome? It is again, yes, yes, mannitol. Now, the diuretic of choice in mountain sickness. Mountain sickness, very good. Acetazolamide. Acetazolamide. एक्चुअली दे इंक्रीज द चांस, अगर आप सेरेब्रल हेमोरेज वगैरह में यूज करोगे, दे विल पुल आउट द दिस फ्लूइड एंड दे विल कॉज सेरेब्रल एडीमा. वी डू नॉट यूज देम इन दिस कंडीशंस. ठीक है, दे आर गोइंग टू इंक्रीज द चांसेस. ऑलराइट, ये दीज आर द फ्यू इंपॉर्टेंट पॉइंटर्स. ठीक है, विच आर वेरी इंपॉर्टेंट. ये डायरेटिक्स में बार बार पूछे गए हैं. सो दीज आर द फ्यू इंपॉर्टेंट पॉइंट्स विच यू शुड नो अबाउट द डायरेटिक्स. ड्रग ऑफ चॉइस कहाँ पे है एंड और इसमें और कौन कौन से कहाँ कहाँ पे विच आर यूज्ड. सो दैट इज व्हाट इज मोस्ट इंपॉर्टेंट हियर. ठीक है, नाउ लेट्स गो टू द सेकंड वन, द सेकंड एमसीक्यू. You say dual GLP-1 and GIP analog approved for diabetes mellitus. 242222 semaglutide. Okay. Okay. Very good. Those who have answered 3, very good. Jiten, very good. और कौन किसने किया आंसर 3? दो जितेन ने किया. सो इट इज दिस वन, tirzepatide. ठीक है, दैट इज द मोस्ट इंपॉर्टेंट हियर. These two, sorry, not this, these two. This semaglutide is GLP-1. Pramlintide is an amylin analog. ठीक है, और this is for GLP-2 analog. ठीक है, GLP-1, GLP-2 and the other one is GLP-2 and this is approved for recently for the short bowel syndrome. Please remember this. ठीक है, about this for the short bowel syndrome. Alright, now let's get on to the quick shots for some very important here. Quick revision. ठीक है, anti-diabetics which can cause weight loss. Anti-diabetics which can cause weight loss. One is, yes, metformin or metformin, yes, that is one. GLP and DPP4 inhibitors. So GLP-1 agonists, yes. Then liraglutide, okay. SGLT2 inhibitors, very good. SGLT2 inhibitors. DPP4 doesn't cause, ठीक है. And one more, not weight neutral, it has been seen to cause a weight loss. ठीक है, so ये देखा गया it can cause weight loss, so I would not label it as weight neutral. ठीक है, yes, yes. So ये pramlintide also been associated. ठीक है, so it has been, so see what you should answer according to what the books and the journals have to say. So because they say that it has been associated with weight loss, so let's go with that. Weight neutral specifically, actually it is mostly mentioned for DPP4 inhibitors. ठीक है, so they are weight neutral, so you can mark that there. So anti-diabetics which can cause fractures, yes, someone mentioned SGLT2. SGLT2 inhibitors. ठीक है, और some other, एक और. Good day Rishi, yes. And even pioglitazone, yes, pioglitazone. These two have been associated with the fractures, especially this one in the females. ठीक है, so anti-diabetic effective in PCOD. Anti-diabetic effective in PCOD. PCOD, metformin, yes, metformin, excellent. Anti-diabetic, which is now given, or it is a drug which is given in diabetic dyslipidemia. डायबिटिक डिसलिपिडीमिया में हम कौन सी ड्रग यूज करते हैं? Colcivelum. It is a, I will give you a hint, it is a dual PPAR agonist. Yes, you're right. Saroglitazar, ठीक है, ये याद कर लो आप, saroglitazar, ठीक है, saroglitazar, saroglitazar. It is a dual PPAR, ठीक है, alpha also and gamma also. So gamma is associated with the diabetes, decreases the insulin resistance. Alpha is associated with the action on the lipids. Which of the anti-diabetics is safe in renal failure? Safe in renal failure. Yes, one is linagliptin. Yes. Glimepiride. Okay. One is linagliptin, yes, or GLP-1 में से भी, analogs में से भी, any analog which is safer or can be given in renal failure? Liraglutide, they can be also given in renal failure. ठीक है, liraglutides can be also given in renal failure. Linagliptin is one of the SGLT2 inhibitors, linagliptin, which is safe in renal failure. So अगर मैं, I'm asking about all over the anti-diabetics, ठीक है, so you can use this also. And liraglutide, even semaglutide, they are safer in renal failures, right? Okay. Anti-diabetics to be avoided in heart failure, which can precipitate the chance of heart failure. Anti-diabetics avoided in heart failure. Anti-diabetics avoided in heart failure. So they are your, yes, glitazones. Retention है ना, they cause sodium and water retention, जो भी cause करेगा, that will cause this, ठीक है. And there is one more which is associated, is linagliptin. Glitazones especially, ठीक है, ये दो हैं, you remember, they are avoided in heart failures. Glitazones and these two are supposed to be, yes. Anti-diabetic which is approved to be used in both type A. Yeah, actually MI it has, that's why India में ज़्यादा use नहीं करते, we use pioglitazone mostly, ठीक है, that is another reason. Insulin, yes, anti-diabetic अगर, yes, अगर मैं लगा दूँ drug apart from insulin, very good, it is pramlintide. Approved is pramlintide, ठीक है, as a drug which is approved is pramlintide, ठीक है, important, yes, insulin and pramlintide. Very good. So let's get on with the other one now. Let's come to the third question. Which of the following drugs out of these can cause this? Phenytoin. No, not valproate. Phenytoin. Phenytoin is the answer. Very good. Phenytoin is the answer. ठीक है. And what is this condition called as, जो phenytoin ने cause किया है? क्या कहते हैं इसको? What is this? Very good. It is called as excessive growth of facial hair, hirsutism. Hirsutism. right? Excellent. Now let's do some important side effects of anti-epileptics. ठीक है, side effects of anti-epileptics करते हैं. Very very important. Again, one important topic you cannot afford to miss. It is hirsutism. Hirsutism. Phenytoin का लिए you remember the side effects with the mnemonic high hydantoin. Now ये जो mnemonic है, this is for the side effects which occur at therapeutic dose. See, they have side effects which occur at high dose. They have side effects which can occur at therapeutic doses. So make sure if they're asking you any of the side effects, there was a question, which of the following side effects occurs at therapeutic dose? Then you have to write the ones which I'm going to tell you in this side. And if there is a side effect asked, which of the side effects occur because of increase in the dose? So those are your CNS side effects, mainly ataxia and nystagmus like side effects. They occur at when you give a higher dose. Okay? Now let's do the mnemonic for phenytoin. Okay? Yes. So we do high hydantoin. H-I-G-H, high hydantoin. And first H is for hypersensitivity reactions can occur. I say we have two. Increase in the vitamin D metabolism causing osteomalacia. Mind you, it's not osteoporosis, it is osteomalacia. The second is they interfere with the folic acid absorption leading to megaloblastic anemia. G, gum hyperplasia or hypertrophy. H, one is hirsutism again, and the other one you can remember hyperglycemia. और जो रह गया hydantoin, simply remember as you like, fetal hydantoin syndrome. Fetal hydantoin syndrome. Easy to remember. HIGH, high hydantoin. Hydantoin is the chemical nature of phenytoin. Okay. So you can remember by this. Valproate. Okay. How I remember valproate is by the spelling of valproic. Okay. So first let's see. It is a drug of choice in the generalized tonic-clonic seizures, myoclonic seizures. ठीक है, मेनली एटोनिक सीजर्स यहाँ पे इनका ड्रग ऑफ चॉइस है. Valproic I remember as is by valproic itself. ठीक है, so V you can remember vomiting or nausea. These are the gastrointestinal side effects. A is for alopecia. L is for liver toxicity or hepatotoxicity. P, pregnancy contraindicated because it causes neural tube defects or spina bifida. R, it can cause rash. O, obesity or weight gain. Okay. ठीक है. I, you can write increase in the tremors. ठीक है. And C is curling of hair. So these are the important side effects of valproate. ठीक है, valproic acid or valproate you want to see. Right. So ये हो गए important side effects of the valproic acid. Simple to remember, phenytoin with high hydantoin, valproic, even if you remember the spelling, you can remember the side effect. Or whatever mnemonic you have learned, good to go. No problem in that. ठीक है. So carbamazepine का जो important side effects हैं, it is a drug of choice for partial seizures. Hepatotoxicity, let's do this with a different one. So it causes hepatotoxicity, dilutional hyponatremia. Dilutional hyponatremia. Important है dilutional hyponatremia. because of the ADH action. ठीक है? Dilutional hyponatremia. This is important for carbamazepine. Valproate is more teratogenic. ठीक है? Next, we go to the topiramate. Topiramate, you remember, this is the most important. These first two are more important. The renal stones, it can cause renal stones, ठीक है? And it can cause weight loss. So if you remember, yesterday we had done this MCQ regarding which of the recently approved drugs has been used in combination with phentermine, and that was topiramate. So topiramate causes weight loss, so has been used as a combination, yes, in the management of this topiramate with the obesity के साथ, ठीक है? phentermine के साथ इसको use किया गया है. Yes, migraine also, that is the use. I'm talking about why इसका जो adverse effect has been put to use now. It was an adverse effect, but now because of this, it has been put to this. Yes. Yes, we'll do the craving and alcohol. That also we'll do later. Zonisamide has renal stones. Yes. Lamotrigine, major problem is the rashes. And it can be as serious as a SJS, Steven-Johnson syndrome also. That is the most problematic with this. Reticabine, or the other name is ezogabine. ठीक है, potassium channel opener है, and it can cause urinary retention, blue pigmentation, and remember reti for retinal toxicity. These are the few important side effects for reticabine. Felbamate, why the use has declined now? Because of the major problem of hepatotoxicity and aplastic anemia. And vigabatrin is with we say visual field effects. ठीक है, ये कुछ important areas है, ये तो questions है. This has been visual field effects. ठीक है. So these are the important side effects of various anti-epileptics. Let's go to the next question now. All right. A patient diagnosed with bipolar mood disorder is started on lithium. ठीक है? So the therapeutic action of lithium is now due to the inhibition of. The therapeutic action of lithium is now due to the inhibition of. Okay, Dark Knight says 1, Sam says 2, Shipra says A, yes, so 2, Jiten says 2, Hariharan says 2, Rishabh says 2, okay. See, direct effect or indirect effect, there are two kinds you have to be sure of. So when they're talking, this is actually basically inhibit directly किसको कर रहे हैं, ठीक है? So if you see inositol phosphate से, it becomes inositol here, ठीक है? And then the further reaction goes on. The lithium acts at this step. ठीक है? So if this question is asked, where does lithium act? See, whatever will happen, jo PIP2 and IP3 DAG phospholipase, it occurs later. So IP3 comes here and DAG comes here. It occurs later. These are the indirect effects, not the direct action here. ठीक है? So whenever this actually inhibition kisko ho raha hai, it is not allowing the conversion of this first step. So lithium is going to inhibit the inositol monophosphate. Triphosphate diacylglycerols come at a later stage, and this is the indirect action of lithium. Direct action would be at this very stage. Okay, so this is the inositol monophosphate is the correct option here. Now, this lithium as such is another important drug which is very, very frequently asked, and we have to know certain important things, which is something which I call is must know. Must know. Okay, you have to read them for lithium. So it has a narrow margin of safety. We all know it has a narrow margin of safety. कल हमने therapeutic index भी किया था, उसमें कहा था this is the drug which has a very narrow margin of safety. ठीक है. So 0.5 to 0.8 is required for maintenance. 0.8 to 1.2 is required for acute mania. ठीक है. Yes. And if in exam they ask you 0.5 to even 1.2, so this would be your safety range. This is the correct range. How toxicity कितने range पे होती है? How when the toxicity manifests? Yes, toxicity manifests more than equal to 1.5. And what are the toxicity features? Vomiting, diarrhea, coarse tremors. ठीक है? So we can have vomiting, we have diarrhea, we can have coarse tremors. This was the question asked. The patient में जो vomiting, diarrhea, coarse tremors है, ataxia है, identify the drug causing this. So lithium is the drug which can cause this. Treatment of toxicity, dialysis only if the level goes above 4. If the level goes above 4, yes, then there is treatment of, then you have to do toxicity treatment karna hai. Important other thing is it has an anti-suicide property. Okay, which of which drugs has an anti-suicide property? Lithium. Which is the most common side effect? Tremors. Tremors are the most common side effects seen with lithium. Others are hypothyroidism, diabetes insipidus. And we have just done lithium-induced diabetes insipidus. The treatment will be amiloride. Okay? Amiloride. Yes. Why is it contraindicated in pregnancy? Because it causes abstinence anomaly or cardiac defects cause करती है. So let's say there is a patient, a female patient who has mania. What will you use in that patient? A pregnant female जो है, she has mania. What will you use in that patient? The first trimester. Tricuspid atresia, yes. What will you use in the first trimester? Lamotrigine. Atypical antipsychotics. You have to use atypical antipsychotics. You use, they are preferred first. Atypical antipsychotics, never benzodiazepines. Atypical antipsychotics are to be used, and then because they are the safest, like olanzapine, ठीक है, quetiapine, they are there. So pregnancy में you use atypical antipsychotics. All right, great. Yes, drug of choice is atypical antipsychotics. All right, next. New drug पे question आया था, so let's go to this. New drug approved for ALS, amyotrophic lateral sclerosis. New drug approved for this. Darkness says 1, Sam says 1. Very good, excellent. Yes. It is edaravone. Very good. It is edaravone, which is a newer drug. Which is the other drug which can be used in ALS? Other drug which can be used, it's a free radical scavenger. और कौन से? Yes, riluzole can be used. Riluzole can also be used. And what is riluzole? It is an NMDA antagonist. ठीक है? Riluzole is a NMDA antagonist. कुछ और NMDA antagonists पढ़ते हैं, which are the important ones. Yes, free radical scavenger means it is an antioxidant. ठीक है? ये हैं some of the important NMDA receptor antagonists which are important. ठीक है? First is memantine, used for Alzheimer's disease. ठीक है? Acamprosate, used to decrease the alcohol craving. तो यहाँ पे let's take a pause and discuss which are the other drugs which can be used for alcohol craving. Other drugs which can be used for alcohol craving. Other drugs which can be used for alcohol craving. Disulfiram is used to prevent the aversion, not for craving. ठीक है? So यही difference है. Disulfiram हमें aversion, not for craving. Ondansetron, very good. Naltrexone, yes, very good. Ondansetron, naltrexone, acamprosate. What else? Topiramate, excellent. Yes. So you remember the drugs which decrease the alcohol craving. Remember mnemonic, no to alcohol. So you say no to alcohol. No to alcohol. N say naltrexone. O say ondansetron. T O topiramate. And A is acamprosate. Okay, so no to alcohol are the drugs which decrease the alcohol craving. Now, which are the drugs used to prevent the withdrawal of alcohol? Yeah, first let me drug of choice for preventing the withdrawal or used in the withdrawal of alcohol to prevent that. Drug of choice first. Benzodiazepine कौन सा? No, not diazepam. No, benzodiazepine is not the answer. I want the specific drug. Diazepam, no. Not the drug of choice. No, not lorazepam. Lorazepam is a drug of choice of status epilepticus. Very good, Sam. It is chlordiazepoxide. Okay? No, not chloridine. Chlordiazepoxide. I'm asking the drug of choice. Okay? Drug of choice is chlordiazepoxide. Agar this is not given in the option, then you mark diazepam. Okay? Prevent withdrawal. If chlordiazepoxide is in the option, then you have to mark chlordiazepoxide. If it is not in the option and diazepam is in the option only, then diazepam is fine. But agar both of them are given, then you have to mark chlordiazepoxide. Okay, so this was also about a nutshell about the alcohol में जो important things है. Drugs which decrease the aversion, drugs which reduce the craving, which can be used for withdrawal. And also we discussed yesterday the poisoning का हमने कर लिया for the ethylene glycol or methyl alcohol poisoning, fomepizole or ethanol. That we did yesterday. ठीक है? Next, in the NMDA coming to, we use amantadine is also an NMDA antagonist for Parkinsonism. Ketamine is used for dissociative anesthesia. And then we have felbamate, which is an anti-epileptic, but the use has declined because of the major cause is your hepatotoxicity. Major cause is hepatotoxicity, the use has declined. So these are your few important NMDA antagonists and the uses, what are they used for, right? Okay, let's go to the next question. Again, asked recently. Here, what you have to do, I will enlarge this a bit. And what you do here is tell me which site. So there are sites marked 1, 2, 3, 4, and 5. On which site 1, 2, 3, 4, 5 कौन से साइट पे vancomycin is acting? 1, 2, 3, 4, 5. On what site does vancomycin act? That is what you have to tell me. Dark Knight says 4. Campylobacter says 2. Dr. Joyce says 4. Chaitanya says 4, 4, 4. Jiten says 5, 4. Shubham says 4, Optimus says 4. Very good. So the correct option is 4. Okay, so correct. Yes, these are all cell wall synthesis inhibitor and the correct option is 4. And let's see here. So this is the actual one. Okay, so this is where it acts. 4 side पे vancomycin act करता है. So 1, 2, 3, 4, 5. Site 1, 2, 3, 4, 5. So if you have to remember this, yes, FCB, or you can remember first cycle, बाद में van और उसके बाद Land Rover. धीरे धीरे पैसे आएंगे ना, and then we buy expensive things. So first cycle, बाद में is bacitracin, vancomycin, and then Land Rover is your beta lactams. So first is your phosphomycin, which inhibits the conversion of NAG to NAM basically, UDPG to UDPM here. The second one is your cycloserine. Cycle is cycloserine, inhibits the formation of D-alanine. D-alanine has to be among the, जब हम जो 5 last two DLR form करेंगे, then only the cell wall is formed. Fortuner, you can write Fortuner as you wish. Fortuner doesn't rhyme with beta lactam, no, so I wrote Land Rover. ठीक है, चलेगा. Anything that you can write. So उसके बाद the next one is bacitracin. The third point is bacitracin, and this bacitracin will not allow, because this is all happening inside the cytoplasm. So ये सारा chain has to move out into the outside the cytoplasm. So bacitracin, it inhibits, actually there is, ठीक है, यहाँ पे inhibits the flipping out of this whole complex. So that is bacitracin. Then vancomycin. Vancomycin, yes, bacterial cell wall is there. So vancomycin, it actually caps the D-ala and inhibits the entire enzyme transglycolase. ठीक है, so ये difference है, and it caps the D-ala. It will not allow later the cross-linking. Beta lactams also do this, same. But the site of action is different. They act on the transpeptidase. That is the difference in vancomycin and the beta lactams. Transglycolase and transpeptidase. ये दोनों का difference है in the vancomycin and this. So remember this one, because next time they can ask you where does beta lactam act. Next time they can ask you where does phosphomycin act, bacitracin. So ये ही है the sequence 1 2. तो this is very well given in the book Katzung. If you know the Katzung book में बहुत अच्छा सा diagram बना हुआ है. You can go and check there. And remember this mnemonic from 1 to 5. How to remember? First cycle, बाद में van and Land Rover. ठीक है? So this is how you remember this. Now why I took this here is, let's discuss a few points about this drug, which is vancomycin. ठीक है, vancomycin के बारे में कुछ important points हम discuss करेंगे. Alright, now vancomycin is used orally for PDF of current session. I'll see if we can post it somewhere. ठीक है, because अभी I'll just you can speak to the team. PDF अभी है नहीं इसका. I will see if how can we do that. ठीक है, if they want the PDF, I can just deliver that. I'll talk to the Unacademy team. Alright. Okay. Orally for, very good, pseudomembranous enterocolitis. ठीक है, IV for, very good, some of you have already. IV किस लिए? Pseudomembranous enterocolitis, orally use करना है. It is inside, intestine में जाएगा. Yes, IV for MRSA, excellent. This is the drug of choice for MRSA. Most common side effect seen with vancomycin. Yes, MRSA, excellent, yes. Most common side effect seen with vancomycin. No, most common जो है इसके साथ है maculo. It's not the most, red man syndrome is not most common. It is seen with vancomycin, but most common is maculopapular rash. ठीक है, and then it can develop into a, you can see it is one of the features है red man syndrome में develop हो जाता है. But आजकल it is not common because we know what to do. How can you prevent this rash, red man syndrome? How can you prevent this red man syndrome? Because now we know how to prevent this. It's not a very common thing now, but yes. Nausea, vomiting, yeah. Yes, very good. We give a slow IV infusion. Over 60 minutes ka, we give slow IV infusion over 60 minutes and dilute it and give over 60 minutes. Or you can even give pre-treatment with, yes, very good, antihistamine. Because this is because of histamine release. So you can give the antihistaminic here. ठीक है, so antihistaminic दे सकते हैं. And it needs dose reduction with renal failure. So it should not be combined with which drugs? Any important drugs or antibiotics जिसके साथ we should not combine them? किसके साथ नहीं combine करना चाहिए? Very good. Aminoglycosides one or yes, one of the most dangerous or aminoglycosides most nephrotoxic. Yes. Then tetracyclines, especially the expired tetracyclines, except doxycycline. Then cephalothene, cephaloridine, these are few of the drugs which have been shown to cause this nephrotoxicity. So not to be combined with this. Okay? So let's say this was in one way which you can they can ask you ki Redman syndrome, which is very important, can be caused by what? The other way is they can give you a picture of a Redman syndrome. Okay? So this is a picture of the presentation of a Redman syndrome. So they can ask you next time which of the following antibiotics or the drugs shows this. Okay, so this is a Redman syndrome and vancomycin would be the correct option here. Because so these are the different presentations of Redman syndrome, right? Sure. Okay. Okay, another picture for you to identify. Name the drug which can cause this. First you identify what is this and then you can name the drug which can cause this. Very good. Bleomycin. Now this is actually called as very good compiler. Flagellate dermatitis caused by bleomycin. It's flagellate dermatitis. The specific name is flagellate dermatitis caused by bleomycin. And the second is hand and foot syndrome. Very good. Capacitive bean, yes. So even 5-fluorouracil, most common is there. So this is the hand and foot syndrome. ठीक है, ये important दो pictures हैं which can be asked whether in the text form or whether in the picture form. So you know this 5-fluorouracil. So I'm going to give you a list of specific adverse effects. ठीक है, जो बहुत important है. All we can't discuss. There are so many, but जो important हैं what we can actually see here. ठीक है. So these are some important side. Vincristine के साथ one is neurotoxicity, the other important is syndrome of inappropriate ADH secretion. ठीक है. Cytarabine, this you can afford. Cerebellar toxicity. Bleomycin busulfan, very important, causing pulmonary fibrosis. Other drugs causing pulmonary fibrosis. You can remember BBC, ban me. Bleomycin, ठीक है. कौन सी है? Bleomycin, busulfan, cyclophosphamide, bromocriptine, amiodarone, nitrofurantoin and methotrexate. ठीक है. BBC, ban me, remember. And what is the treatment for pulmonary fibrosis? वो भी पूछा हुआ है because this one, whether it is the drugs causing or whether it is a treatment, both are important. Treatment for pulmonary fibrosis. Pirfenidone. One drug is pirfenidone. The other is nintedanib. Yes, very good. Nintedanib. ये two important drugs हैं that you should know. ठीक है, pirfenidone and nintedanib. Pulmonary fibrosis is another very expected question, can be asked or has been asked, right, rather. 5-fluorouracil, I just showed you the picture. Which is most important is hand and foot syndrome. ठीक है, hand and foot syndrome, and you can give pyridoxine actually for a prevention or treatment. Pyridoxine for this. अगर पूछते हैं प्रिवेंशन के लिए, we can give pyridoxine alongside. Then vincristine is also, and paclitaxel is also associated with neuropathy, the peripheral neuropathy. ठीक है. Doxorubicin, donorubicin, very very important. Ruby is red in color and red is your heart. ठीक है. Ruby is red in color, ruby stone red in color, ruby is your heart. It is cardiotoxic, very cardiotoxic drug. And how can you prevent this? How can you prevent this? How can you prevent this? What do we give? What do we give? Very good. We give, it's an oral, it's an iron chelator, IV iron chelator. You disowning, it is dextrazone. Dextrazoxone. ठीक है. Dextrazoxone. एक second, let me correct it. Spelling is confusing here. Dextrazoxane rather. ठीक है. Dextrazoxane. So it is an oral iron chelator. क्या होता है? When this drug enters into the body, it forms a complex with the iron which is cardiotoxic. Now this IV dextrazoxane is going to take away the iron and therefore it is going to help or minimizing the cardiotoxicity. ठीक है. Then pemetrexate, methotrexate, very important इसका है bone marrow suppression, which is more important is bone marrow suppression. Cisplatin, highly nephrotoxic and highly emetic. Highly nephrotoxic, highly emetic drug. Highly nephrotoxic, highly emetic. Emetic होता है इसकी जो emesis है, it can be early, it can be late. So treatment, अगर early emesis है, what we give? We give 5-HT3 antagonists like ondansetron. ठीक है. और अगर late है, the drug of choice is iron deficiency anemia, IDA. Why? It is just given for some time. Iron deficiency anemia doesn't occur as such, it occurs over a period of time. We are giving it for just some time. इसको करने के लिए. What is this? Epripetant, very good. Epripetant. और एक हमने यहाँ पे again I missed this one. Let's do methotrexate. हमने we did yesterday folinic acid और leucovorin. ठीक है. And extreme methotrexate toxicity. Extreme methotrexate toxicity. There is an enzyme glucarpidase. Extreme methotrexate toxicity, glucarpidase. Otherwise, we give folinic acid or leucovorin. Okay. Cyclophosphamide, very important again, causes hemorrhagic cystitis because of the acrolein. The metabolite is acrolein and the treatment is Mesna. ठीक है. Another important question. Very good. Irinotecan, it causes a cholinergic syndrome, yes, which leads to diarrhea. That can lead to, or which can be treated with the antidiarrheal, and that is your loperamide. Loperamide can be given for management of diarrhea with irinotecan. ठीक है. Procarbazine, disulfiram-like reaction. Procarbazine, yes, Jitain, disulfiram-like reaction. So these are the few side effects which are specific to the anti-cancer drugs. नाउ द फ्यू साइड इफेक्ट्स विच आर कॉमन. ठीक है, कॉमन कौन से हैं? These are the common side effects. Now we'll quickly go through the side effects and the prevention. Or anemia. Anemia, what do we give? Epoetin and, or you can give darbo. We can give darbopoetin alpha. Epoetin, darbopoetin alpha. Yes, epoetins. न्यूट्रोपीनिया आया था इस बार एग्जाम में. फिलग्रास्टिम. ठीक है, granulocyte colony stimulating factor. Very good. Tumor lysis syndrome. Tumor lysis syndrome leads to rise in the uric acid levels. Yes. Allopurinol and also rasburicase. Drug of choice यही है, allopurinol, rasburicase. Thrombocytopenia. Oprelvacin. ठीक है, Oprelvacin. Yes, very good. Mucositis. Palifermin. Yes, it is a recombinant keratinocyte growth factor. Palifermin. A nausea, vomiting. The best drug we have are your 5-HT3 antagonists, which is like ondansetron. ठीक है? Yes, 5-HT3 antagonists like ondansetron. So these are few important points about, or quickly we did about the major important side effects of. Choice में यही हम करेंगे. ठीक है, ondansetron you'll mark. Yes, you can use dexamethasone, but अगर आपको पूछा जाता है the drug of choice, then you will mark ondansetrons. ठीक है? There are so many drugs that we can use as alongside these drugs, but this is the drug of choice. Now quickly we go to this last question, and this question is only apt or applicable if you're appearing for NICT. ये पूछा गया है पिछली बारी, and this has a high probability of coming because they are very fond of asking this. But NEET PG, FMG, this is not very very important. ठीक है, so only NICT के लिए सबसे ज़्यादा important है अगर कोई appear हो रहा है. ठीक है, and if you're preparing for this, then you can mark this here. Which of the following is not an immune checkpoint inhibitor? Very good, it is eculizumab. Excellent. And how do we know this? You remember, you can take a snapshot of this. This is actually your mnemonic to remember which are the immune checkpoint inhibitors. ठीक है, so if you remember जो भी हैं checkpoint inhibitors, obviously the rest can be removed, the rest can be taken off. ठीक है, eculizumab against, yes, it is used in paroxysmal nocturnal hemoglobinuria against complement 5, eculizumab. So we are not supposed to remember each and every, because monoclonal antibodies as such, it's very difficult to remember them. ठीक है, so just remember the major immune checkpoint inhibitors, and you remember the mnemonic new star drugs acting at immune checkpoint receptors. This one, the last one, is the most recent one. ठीक है, which is your retifanlimab. It is very very recent, so high probability of them being this drug being asked. Very recent. Nivolu, इसमें से the ones which are marked in red have been asked, so therefore they have more probability of coming in the exam. Nivolumab is used for Hodgkin's lymphoma. ठीक है, nivolumab is for Hodgkin's lymphoma, and these are your the other dostarlimab, durvalumab, evolumab, azitolizumab. So there are so many of them you can remember. Brackets में here, this is the receptor against which they act. ठीक है, against the receptors which they act. But I'm again saying monoclonal antibodies भूल भी सकते हो, डजेंट मैटर, बट ये इसके लिए इम्यून चेक पॉइंट इनहिबिटर्स फॉर NICT ज़रूरी है, सो यू मार्क दिस फॉर देम, ठीक है। एंड ये इसमें 3 ड्रग्स हैं, निवोलुमैब, पेम्ब्रोलिजुमैब एंड रेटिफैनलीमैब। रेटिफैनलीमैब इसलिए ज़रूरी है, इट इज़ यूज फॉर मर्कल सेल कैंसर and it has been recently approved. And pembrolizumab has been asked again, time and again, as is nivolumab. So ye dono, out of all of them, these 3 are the most important. The last one I'm going to talk about how to remember the important uses of pembrolizumab. So just remember the embrol here. Ye important uses hai to remember for pembrolizumab. एम्ब्रॉल एक याद कर लो, ठीक है। सो एंडोमेट्रियल कैंसर, इन मेलेनोमा, ब्रेस्ट कैंसर, ट्रिपल नेगेटिव, रीनल सेल कैंसर, ईसोफेजियल कैंसर एंड लंग कैंसर, नॉन स्मॉल सेल कैंसर्स, ठीक है। सो ये इंपॉर्टेंट यूजेस हैं ऑफ पेम्ब्रोलिजुमैब विच इज एन इम्यून चेक पॉइंट इनहिबिटर, ठीक है। These are the most important uses of pembrolizumab. Right, so with this we come to the end of today's session. This was the quick questions which I could gather from the other topics which were left yesterday. And just jo bhi important, I hope you were able to revise, those who are just appearing, as I said yesterday also, those who are nearing their exams. So this was a very quick revision for them, and those who have exams at a later stage, you can obviously incorporate all these points, and ultimately that can be your notes. In your notes, wherever you have already made the notes, please incorporate them. These are very, very high yielding points, have been asked time and again. So therefore I recommend that you should go through this even later on also and write these and practice on them, ठीक है। जितना you can practice on them, the more you will be more confident in your practice and examination. So thank you everybody, thank you for being here, and keep practicing, keep consistently, keep on working. As I say, consistency is more important than intensity. कि एक दिन आज इतना काम किया, the rest you don't do. Be consistent with your work, be consistent with whatever you are doing, and keep your target or keep your goals in your mind, and just continue working hard. And I'm sure that you will get whatever you are aiming for, right? So thank you so much. Have a great evening and enjoy your weekend, or study hard and even relax also in the meanwhile. So I'll see you in the next video, in the next lecture very soon.